Before you inject it, swallow it, or rub it on your face, you need to know exactly what it does. I'm Dr. Melissa Ramsey, the weight loss hepatologist, and welcome to my Coffee Talk series, where we break down health and wellness topics in a way that actually makes sense. Today, we are breaking down 3 treatments that are getting a lot of attention: NAD, GHK-CU, and BPC-157. I'm going to explain each one, what people commonly use it for, and how it may be taken, and a few of the side effects that you may want to know. So let's get into it. NAD. It is used for cellular energy. And let's start with NAD, which stands for nicotinamide adenine dinucleotide. Say that 5 times fast. It is often discussed alongside with peptides, but it's not technically a peptide. It is a natural coenzyme that helps your cells turn food into usable energy. Think of it as part of your body's internal charging system, helping your cells power up and function efficiently. This is why people may seek NAD for fatigue, mental clarity, exercise recovery, and just the healthy aging process. NAD may be given a couple ways: infusion, subcutaneous, and actually as a drinkable supplement. However, subcutaneous, I personally believe, works the best. Anything that you inject right into the system, you're always going to get the best maximum results. And 2 main side effects from this is nausea and headache. So you kind of want to look out for that. GHK-CU. Let's talk about this one. This is also called the copper peptide. It is a naturally occurring peptide that attaches itself to copper. Peptides are small chains of amino acids that can act like messengers in the body. And GHK-CU is mainly discussed for its possible role in skin repair, collagen support, wound healing, and hair health. Think of it as a tiny construction supervisor. It shows up and starts giving instructions. We need more collagen over here. Right there. And somebody please check those hair follicles, because you can also put it in hair. GHK-CU is commonly included in facial creams, skin serums, scalp products, and other treatments for collagen, like microneedling. And the topical use is more common, while the injectable use is another option offered by some providers, but I would choose the topical. People may use this for getting firmer skin, helping with wrinkles and so forth, and also hair growth. 2 main side effects from this is skin irritation and redness, although it depends on how the product is used. GHK-CU may support your skin, but it is not going to do the work itself. So you need to use your proper skincare and also protect your skin with SPF. And drinking your water, hydration, guys. If you think your skin is looking dry or wrinkled, but you're not drinking enough water, yeah, we gotta start right there. BPC-157, recovery and healing. Let's talk about this one. This is probably the peptide that's receiving the biggest drum roll online. BPC-157 is a laboratory-made peptide, and it is promoted for healing and recovery. People commonly talk about it for tendon injuries, ligament injuries, muscle recovery, joint discomfort, inflammation, and digestive concerns. The 2 main side effects are commonly headache and nausea. People may also find redness at the injection site, because you actually kind of want to get it close to the injection site when it's for tendon repairs. And you only want to take BPC-157 for a short amount of time, maybe about a 6-week time frame, and then you want to take a break. So the takeaway from this is that these peptides, they all have different goals, just depending on what your symptoms are, your health history, current medications, and really what you're trying to achieve. Schedule an appointment with your primary care provider or me to discuss which option may be the best fit, the safest way to take it, and how long it should be used. Do not choose a treatment because it's popular. Choose it because it makes sense for your health, your goals, and your body. I'm Dr. Melissa Ramsey, the weight loss hepatologist. And remember, before you inject it, swallow it, or rub it on your face, make sure you understand what it does and why you're taking it. Till next time.